Greetings all. Now we are going to see about the selection and use of the personal protective equipment. Selection and use of the personal protective equipment is a guide to select the use personal protective equipment in the hospital, and the PPE is used for the patient, visitors and healthcare providers from infection. Personal protective equipments also prevent the exposure to the hazardous material. And specialized clothing or material used by a healthcare provider to prevent the contaminated exposure. Occupational safety in a healthcare. Workplace safety, it regulates the hospital. Indications for the PPE have to know, and selection of the appropriate PPE and correct method of using PPE after using proper disposal and training on the personal protective equipment. And types of the personal protective equipments are consist of gloves, respirators, gowns or aprons, goggles or face shields, shoe cover. Factors influencing the use of personal protective equipment selection. Type of exposure is anticipated, contact, splash, droplet and airborne. And duration of the exposure is anticipated. Gloves. So gloves is used to providing a patient care, environmental cleaning and performing the procedures. We have different types of gloves, that is vinyl, latex, nitrile and sterile and non-sterile gloves. All the gloves are intended for the single use only. Gloves. It's a learned correct method of using the gloves and removing the gloves. Always walk from the clean area to dirty area after wearing the gloves. Don't touch your face, ears, eyes, mouth or nose after using the sterile gloves, and don't touch the environmental surfaces unnecessarily. Change the gloves in between the patients. Change the gloves if it is heavily contaminated. Discard it in appropriate biomedical waste bin. Never wash or reuse the gloves. Here you can see the method of using a gloves and method of removing a gloves. You can see here, according to this order we have to remove the gloves, then only we can prevent the unnecessary contamination in our hands. Gown or aprons. The purpose is to prevent the exposure to the infectious agent, to protect from the exposure of blood and body fluids and hazardous material. Types: sterile, unsterile, disposable, reusable, water resistant, non-water resistant, plastic aprons, full sleeve gown, surgical gown with handcuffs, full cover PPE with the hand cover. Here you can see the donning of gowns. Mask. To protect the droplet, airborne infection prevention, to prevent the contaminations of the surgical field from the operator. And types, we have different types of mask in the market. 3-play, either 2-play surgical face mask, N95 respirator, positive pressure respirators, reusable and disposable. Here we have the facility of 3 and 2-play mask and N95 respirator adequately. The right way, use the 3-play mask. Take the mask and then loosen the strap as first, and then fix it the nozzle as like this. The color portion will be on outside. Fix it in the nose like that, and then you have to cover with the straps on each side. Now you have to confirm whether the mask is fully covered or not. Now you can check all the area is closed. Never touch the mask after wearing the mask. About N95 mask. It's a single use only. Can be reused 4 times if there is any shortage in the market. Ensure the fit and leak test before use. Check the tightness, seal all around the N95 mask. Blowing gently should not produce any leak. Forced inspiration collapse the mask. Here in this picture you can see the fit test and then leak test before using this mask. Face shield and goggles. Face shield are used to protect the face, nose, mouth and eyes from the unwanted exposure, both from droplet and splashes from the blood and body fluids. It covers the face from forehead to the area below the chin and sides of the faces up to the ears. Protect the eyes. It should snugly fit in the around eyes. Fogging is in the concern. Personal glasses alone are not useful. Personal glasses can be used with the goggles. Anti-fogging goggles is good always. Shoe cover and gum boots, which is used by the feet to cover the contaminated exposure and the environment. General instruction while using the personal protective equipment. Before and after using the PPE, practices of the hand hygiene is most easiest way to prevent the unnecessary contaminated exposure. Wear the PPE before entering the clinical area. Wear the PPE in the order or suggested in the guidelines. Wear all the personal protective equipment in the correct method. Use PPE carefully. Prevent the contamination as much as possible. Remove the PPE by the instructed method correctly and dispose it in the appropriate containers safely. According to the CDC, we can see here the sequence of the PPE. Hand wash, gown, mask, face shield and hand sanitizer, and you have to prefer for the gloves. After using the gloves, the another part except the patient care area and the sterile things you should not go away. Sequence of removing PPE. First, the contaminated gloves to be removed and remove the face shield, remove the mask and remove the gown, followed by proper hand washing. Here you can see the picture of donning and doffing according to the WHO.